Hi folks, Cancer Healing Vlogs. I look like a mess, and but yet it's like the Corona time, huh? But okay, as a yeah, I'd love to talk about coronavirus. Actually, I kept this topic open ended right now. Okay, I wanted to just let it free flow from what I've been learning. Corona will be a nice topic to talk about, considering that everyone is thinking about it and everyone's talking about it. We all are. We are like quarantined. Like literally the entire world is quarantined. Uh, Obviously, there's nothing that that I'm going to share right now that is just something that you never know about. Pretty much the same jargon you've been hearing since forever. But maybe get a perspective from a budding pathologist as well. Pardon all my senior pathologists and all my colleagues who may watch this video and may say that I am not given all the details and all the information about it as a pathologist, but I'm just sharing whatever few basic things as a medical health practitioner. Let's put it that way. Should know about it, I guess, on some basic level. Uh, okay, so hand washing, mask wearing, and avoiding touching your surfaces, which are you know easy entry points into your body, like the mouth area, is the mucosal surface, eyes. So these areas are avoided to be touched unless your hands are clean. Okay, and how you make sure your hands are clean at all times, especially when you're outside your house. Okay, you gotta go buy groceries, you gotta go buy uh, you gotta go do stuff that might be really required. Every time you step out, just carry this liquid hand wash with you, and use that. uh, Give it to people also, and maybe shake hands, just that elbow bump way, or namaste, or sat sri akal, of course. And so that's why are you doing that, because obviously the virus travels in those little droplets. When a person coughs, what happens is, in fact, even when a person breathes, but forget breathing, it's really, I mean, as a logical understanding, uh, if a person is a passive, like passive, uh, like not yet, symptoms have not yet come, and but still the person is breathing, the chances of the respiratory droplets spreading and reaching your breath is less. But don't invite that, like just keep your quarantine. But yeah, but when they cough, the chances of it, firstly droplets come out and they spread further, so the chances of that spreading to you if you are in the space is higher. Okay, so which is why, if you are coughing, be responsible and stay, even if it's just a regular cough, like not the COVID, still just sit down in your quarantine and don't be a threat to your family and your friends and people around you, your loved ones. And don't worry, you will also be fine, because most of the people are going to be okay. Now, my prediction, it's just based on a hunch and the idea of normally how much time the virus, these viruses take to get out of the system, and knowing a bit about my country, I would say my prediction is that this coming week is just the critical period, after which the intensity will start dying down. And 3 weeks time is what I give for this virus. It's my prediction. I could be wrong. I'm not saying some WHO statement or something. It's just my personal, as a health practitioner, and just some exposure. I say I give it 3 weeks. Mark it from today. I give it 3 weeks. Let's watch. Let's see if I'm right. In India, 3 weeks in India. In the world, rest of the world, maybe in some places where it's a lot, it may take more time, couple of months, maybe 2 to 3 months to completely go. The overall thing for this entire virus, I give it 3 months. 3 months, entire world, like to be stopped. Okay, in like the worst hit places in the world. Okay, uh, be very careful, be alert, and don't get paranoid. Oh my God, don't get paranoid. It's something. Even if some people who get infected, they are being cured. Like there's a 90%. I mean, there's these percentage that people are, there's a mortality rate, right? That people are dying, but there is a huge percentage of people that are comfortably surviving and getting okay. So just make sure you are quarantined. Even if it's just a regular infection, you don't want to take chance, and you'll also be fine. Even if it was corona, you'll get hospitalized, you'll be taken care of, and that's it. Just relax. Okay, take a deep breath. and especially when it comes to the panic that is being spread across the world, this whole media system is they're encouraging people to be panicking, like it's like chalo theek hai, let's spread the panic, spread, I don't care, information should spread yaar. We need to make sure that people are careful, they're worried. If they're worried, they won't get out of the houses. Even in their panic, they'll take some smarter decisions than when they are not at all panicked, of course they don't want the panic to go too high also, which is why the message says don't panic. Uh, but the entire media is ultimately okay with a little panic, because a little panic is required from, from especially for people who don't have any knowledge, any information. Just the panic stops them from taking dumb decisions, you know what I mean? So so you, as an educated person, if you're watching this, you are an educated person, I assume, and if you're not educated person, you are becoming an educated person through channels like these and informations like these. Okay, so just and bring positivity into into the air. Okay, I was gonna abuse there, oh my god. uh Responsibility, man. I don't want this channel to, it's a very respectful concept here, and it's something that I feel from my heart for sharing cancer healing, right? Of course, coronavirus has got nothing to do with cancer, but you know what, cancer patients are also suffering from this, man. Cancer patients are uh, cancer patients are the, they're receiving chemotherapy, right? Sorry about that. They're receiving chemotherapy, right? And it is a very that may affect their immunity as well, and they are susceptible to infection. So especially around, although not so much as the HIV patients. Oh my God, for them it's just crazy, for because their immune system is completely down, right? In HIV patients, uh, people who are receiving transplants, oh my God, for them they need to be very careful because their immunity goes down with the medications. People who are receiving steroids, corticosteroids, not the anabolic steroids which they take for bodybuilding. I'm talking about the steroids for the medicines that they need for their, even anabolic steroids. You need to be careful, but it's not so much with anabolic steroids. I don't think that's got. It's mainly with the therapy. Like kidney immune problems, autoimmunity. The SLE patients, when they need steroids treatment, their immunity goes down, and they need to be very careful to stay in quarantine. Okay, so but spread positivity. Positive vibes is what will bring health. So spread health, spread positive health. Don't talk so much about corona. Talk about health. So let's make it happen. Okay, cheers. Love you all.